Ever wondered what causes gout? Gout is a type of arthritis that sneaks up on you, triggered by an excess of uric acid in your bloodstream. This uric acid forms painful crystals in your joints, causing the inflammation and pain we associate with gout. The big toe is often the first casualty, but gout does not discriminate and can strike any joint in the body. It's a common condition affecting millions worldwide, yet it remains misunderstood by many. It's not just a rich man's disease or a result of overindulgence as some myths suggest. Gout can affect anyone, regardless of age, gender, or lifestyle. It's a serious condition that can cause intense pain and long-term damage if not addressed. Gout, this elusive culprit of joint pain, might seem intimidating, but the more we understand about it, the better we can manage it. So now that you know what gout is, let's delve into what causes it. You may be surprised to learn that gout isn't caused by a single factor. Indeed, this complex condition is the result of a myriad of factors intricately woven together, leading to an excess of uric acid that eventually forms crystals in the joints. Let's delve deeper into what these factors are. First off, diet plays a crucial role in the development of gout. Foods rich in purines, a type of protein, can contribute to an increase in uric acid levels. These foods include red meat, seafood, and alcohol, particularly beer. When we consume these foods, our bodies break down the purines, creating uric acid as a byproduct. Next, genetics can also play a part. If your family has a history of gout, you may be more likely to develop it. Some people are genetically predisposed to produce more uric acid or to have kidneys that are less efficient at flushing it out. Speaking of kidneys, their function is another crucial factor. Healthy kidneys efficiently remove uric acid from the body. However, if your kidneys are not functioning optimally, perhaps due to a condition like kidney disease, they may struggle to eliminate uric acid. This can lead to an accumulation of uric acid in the body, setting the stage for gout. Lastly, certain medications and health conditions can also increase the risk of gout. Diuretics, sometimes known as water pills, can raise uric acid levels. Conditions like high blood pressure, diabetes, and obesity can also make you more prone to gout. Now imagine all these factors working in concert, leading to an excess of uric acid in the body. This uric acid can then form needle-like crystals in the joints, particularly in the big toe, resulting in the intense pain and inflammation characteristic of gout. Understanding the causes of gout is the first step towards managing it. But what happens when gout strikes? Stay tuned as we delve into the symptoms of this complex condition in the next segment. Gout doesn't always announce its arrival with a fanfare. It's a stealthy invader, often catching us off guard with its sudden and severe pain. Imagine the worst toothache you've ever had. Now picture that pain in your joints. That's what a gout attack can feel like. The pain typically comes on quickly, reaching peak intensity in just 4 to 12 hours. It's often described as excruciating, making even the weight of a sheet unbearable. This discomfort is usually accompanied by redness, tenderness, and swelling in the affected joint. Interestingly, gout often chooses the big toe as its first target. It's as if it's got a penchant for the extremities. So if you wake up in the middle of the night with your big toe feeling like it's on fire, gout might be the uninvited guest causing the ruckus. But why the big toe, you might wonder? The reason lies in the temperature. The cooler temperature of the feet can cause uric acid to turn into crystals, and these sharp, needle-like crystals are the culprits behind the inflammation and pain. Yet, gout isn't limited to the big toe. It can also affect other joints like the ankles, knees, elbows, wrists, and fingers. The symptoms here are the same: sudden and severe pain, redness, warmth, and swelling. One thing to note is that these symptoms don't stick around all the time. They come and go. After the initial attack, the pain usually subsides in about a week or so, even without treatment, but don't be fooled. This doesn't mean the gout has gone away. It's just lying dormant, ready to strike again. To add to the confusion, gout can sometimes masquerade as other conditions, making it a bit of a medical chameleon. This is why it's crucial to get a proper diagnosis if you experience these symptoms. These symptoms can be alarming, but with the right treatment, they can be managed effectively. So if you're dealing with these issues, take heart. Help is available, and we're about to dive into that in the next part of this comprehensive guide to gout. There's no magic bullet for gout, but there are ways to keep it in check. This statement rings true as we delve into the various ways to manage and treat gout. First on our list is medication. Doctors often prescribe drugs that can control symptoms and prevent future attacks. Non-steroidal anti-inflammatory drugs, or NSAIDs, are usually the front line of defense against gout flare-ups. They work by reducing inflammation and pain in the joints. For those who can't tolerate NSAIDs, Corticosteroids are another option. These medications can also reduce inflammation and pain, and they can be taken orally or injected directly into the affected joint. However, medication is just one part of the treatment equation. Diet plays a significant role too. Foods high in purines, such as red meat and shellfish, can increase the amount of uric acid in your body, leading to gout attacks. But don't worry, you won't have to say goodbye to all your favorite foods. Just balance them with low purine options like fruits, vegetables, and whole grains. And don't forget to stay hydrated, as water can help flush uric acid out of your system. Alcohol, especially beer, can also trigger gout attacks. So you might want to cut back or eliminate it from your diet. But remember, every person is unique, and what works for one might not work for another. It's always best to consult with your healthcare provider to create a diet and medication plan that suits your individual needs. Now let's talk about lifestyle modifications. Regular exercise and maintaining a healthy weight can decrease your risk of gout attacks. Exercise helps your body function optimally, including the process of eliminating uric acid. Remember, it's not about achieving overnight results, it's about making sustainable changes that you can maintain over the long term. Small steps can lead to big improvements in managing gout. Treating gout is about more than just relieving symptoms. It's about preventing future attacks and maintaining a high quality of life. And with the right treatment plan in place, you can do just that. So here's to living well, even with gout. Living with gout isn't always easy, but it's certainly possible. Now let's delve into some practical advice to help manage this condition. Staying hydrated is an essential part of living with gout. Hydration aids in flushing out excess uric acid from your body, which is the culprit behind those painful gout attacks. So, make water your best friend and aim to drink at least 8 glasses every day. Remember, staying hydrated doesn't mean reaching out for those sugary drinks or alcohol, as they can potentially trigger a gout flare. Your diet also plays a significant role. Certain foods, especially those rich in purines, can increase uric acid levels in your body. To manage gout, you might want to avoid or limit foods like red meat, organ meats, and seafood. Also, try to limit processed foods and those high in fructose. Instead, fill your plate with fresh fruits, vegetables, whole grains, and lean proteins. Taking medication as prescribed by your healthcare provider is another crucial step. Gout medication can help manage pain during a flare and may also reduce the chances of future attacks. It's important to stick to your medication schedule, even if you're not currently experiencing a gout attack. Regular checkups and open communication with your healthcare provider are also of paramount importance. Gout is a chronic condition, and it's crucial to monitor its progression. Regular visits to your doctor will help adjust your treatment plan as needed and address any concerns you may have. Physical activity is another great way to manage gout. It helps maintain a healthy weight, which can reduce the pressure on your joints and lower the risk of gout attacks. But remember, it's important to choose low-impact exercises that don't put extra strain on your joints. Finally, stress management is key. Stress can trigger gout flares, so finding ways to relax and unwind can be beneficial. Whether it's through meditation, yoga, reading a book, or taking a walk, find what helps you relieve stress and incorporate it into your daily routine. With the right approach, gout doesn't have to rule your life. By taking these steps, you can manage your symptoms, prevent future attacks, and maintain a good quality of life despite having gout. So, we've learned a lot about gout today. Starting from the basics, we discovered that gout is a type of arthritis, triggered by an excess of uric acid in the bloodstream. This accumulation can lead to the formation of sharp, needle-like crystals in a joint or surrounding tissues that cause pain, inflammation, and swelling. We delved into the causes, which include diet, obesity, certain medical conditions, and even genetics. We then highlighted the symptoms, such as intense joint pain and lingering discomfort, which are hard to ignore. Our exploration led us to a variety of treatment options, from medication to lifestyle changes, all aimed at managing symptoms and preventing future attacks. We also shared some valuable tips for living with gout, like maintaining a healthy weight and drinking plenty of water. Remember, knowledge is power when it comes to managing gout. Armed with this information, you're well equipped to take control of your health.